Hi, my name is Emily Jacobius, and this is a Pecha Kucha presentation for Survey of Emotional Disturbance. Today's presentation is going to be an informative guide to depression disorders. We're going to start off today with what is depression? Depression is characterized as feelings of intense sadness, including feeling helpless, hopeless, and worthless, that can last from days to weeks to months to years and can keep you from functioning normally. It's often more than just sadness. What are some symptoms of depression? Fatigue or loss of energy, feelings of worthlessness or guilt, impaired concentration, insomnia, significant weight loss or weight gain, loss of interest in activities or hobbies once found pleasurable, persistent aches or pains, and thoughts of suicide or suicide attempts. How can depression be diagnosed? Depression can be diagnosed by working with a doctor. They will ask you many questions, and they may perform a physical exam to rule out other possible medical conditions. How common is depression? About every year, 6.7 million Americans are impacted by depression. It is also good to know that depression affects 2 times as many women as it does men. There are many different types of depression. Types of depression include major depression, chronic depression, bipolar depression, seasonal affective disorder, psychotic depression, postpartum depression, and substance-induced mood disorder. Major depressive disorder can be brought on by a specific event. 1 out of 6 people will succumb to clinical depression during their lifetime. Postpartum depression is depression that occurs after a woman gives birth to a child. This depression is caused by hormonal and lifestyle changes after the arrival of a baby. Chronic depression is depression that is characterized as lasting more than 2 years. Bipolar depression is characterized as mood swings. These mood swings can go from severe mania to severe depression with no warning and in the blink of an eye. Seasonal affective disorder often occurs during the winter. If you're experiencing seasonal affective disorder, you should experience light therapy and psychotherapy. Substance-induced mood disorder is characterized by taking substances that are not necessarily illegal but have potential side effects to cause depression or suicidal thoughts. There are many causes of depression. Causes include abuse, certain medications, conflict in life, death or a loss, genetics, major life events, personal problems, serious illnesses, and substance abuse. There is no one cause of depression, and it does not discriminate. Treatments for depression include psychotalk therapy, drug therapies, and often exercise regimens such as yoga or Pilates. When used together, psychotherapy and drug therapy are the most effective. There are many different drug therapies. These therapies can include selective serotonin reuptake inhibitors, serotonin and norepinephrine reuptake inhibitors, tricyclic antidepressants, and monoamine oxidase inhibitors. If you or someone you know is suffering from depression, you should watch for suicidal thoughts. There are natural ways to cope with suicidal thoughts and feelings. These include promising not to take drastic steps, avoiding drugs and alcohol, and sharing your thoughts and feelings with someone else to make sure that you are safe. If you or someone you know is contemplating suicide, below is the number for the National Suicide Prevention Lifeline. They can be reached at 1-800-273-TALK or at suicidepreventionlifeline.org. Signs of being suicidal include talking about wanting to die, looking for a way to kill oneself, talking about feeling trapped or hopeless, talking about being a burden, sleeping too little or too much, withdrawing oneself, and displaying extreme mood swings. Resources for someone suffering with depression or suicidal thoughts should reach out to the National Institute of Mental Health, the National Alliance on Mental Illness, or the American Foundation for Suicide Prevention. The sources used for this presentation are listed below and include WebMD, the National Institute on Mental Health, the National Alliance on Mental Illness, and the DSM-5.